All right, so apologize for some of you who weren't able to get the seat, so you know next time to show up early, okay? So again, I'm Dr. Douglas Wan, and today I'm going to be talking first half about introduction to whole food plant-based nutrition, and then second half, Mira is going to talk about the how to implement the whole food plant-based nutrition, as well. I'm a minimal invasive spine surgeon, and I also practice regenerative medicine, so stem cell therapy and longevity medicine. But what is a spine surgeon doing up here talking about nutrition? Because I myself, I'll explain in a bit how I'm protecting myself from getting cancer. So, and I'll show you the reason behind it. Also, we have a Facebook group called Regenerative Plant-Based Nutrition. I would love everyone to join the closed group, and where we share ideas, recipes, and then discuss some of the common medical problems. And I personally answer the majority of the questions that comes up on the Facebook group also. So I invite everyone to join as well. Okay? And then also we have Nature's Plate, who does a meal prep for whole food plant-based. They're here, and they have some cookies for us. So if you want, afterwards, you can get a taste of it. And then also we have a sponsor, Regenerative Stem Cell Institute, who I work with here as well, and with some of their products also. All right. So 1 in 4 Americans in the U.S. will die from heart disease. So look around. So 25% of you. So this portion of it may die from heart disease. Okay. 2 out of 5. So if you're sitting next to 4 other people, there are 2 of you, okay, who will be diagnosed with cancer within your lifetime. And half of you, half the room, will be diagnosed with diabetes or pre-diabetes by year 2020. Okay? That's less than 2 years away. That's astounding numbers. Okay? So I did my training at some of the largest medical centers across the country. I did my medical school at UTMB, residency at WashU in St. Louis, and residency, a fellowship in Michigan at William Beaumont Hospital. And you can see how these hospitals are just massive, right? They're filled with patients with chronic disease. This is what I learned how to do. Sorry about the picture, but just a massive spine reconstruction surgeries. But I knew that wasn't the path that I wanted to go, and I worked for the past 14 years to develop techniques to do minimally invasive spine surgery, so we can make either very, very small incision to accomplish the same goal, or utilizing the laser technology so that people don't have to have an open back surgery. And then we went even a step further. So now we're really working on regenerative medicine with stem cell therapy to really help many patients avoid orthopedic surgeries such as total knee replacement, shoulder replacement, and hip replacement. We can't help everyone, but we're able to help many patients avoid surgery and help dealing with their pain. But I got into this because this is the typical scene in the surgery. So doing minimally invasive surgery, we're not opening the patient. So that means I got to do it utilizing the imaging guidance. So here's 1, and not only 1, but 2 X-ray machine intraoperatively. It's a low dose radiation, but for patient, it's a one-time event. But for me, it's an everyday event. I'm constantly getting exposed to radiation, and there's me standing right there. So every single one of you in this room have cancer cells in your body. Okay? Our body is our immune system is fighting every single day, trying to prevent you from developing clinically significant cancer. Okay? So I went on the journey to figure out what's the best way to prevent cancer for myself, because I've seen my other colleagues who got thyroid cancer, cancers in their hand because our hand is under the radiation. And although I'm protected, with my thyroid shield and then vest and then skirt, but I wanted to make sure, I want a nearly a guarantee that I don't develop clinically significant cancer. So, but as I've shown this picture to you guys before, so why do we have so many patients just filling up this hospital? Hospitals are just getting bigger and bigger and bigger with such an advance in technology where you can get your EKG through your smartphone, okay? And then you can get a simple diagnosis and treatment through your cell phone. But yet, the hospitals are getting bigger. And look around within the community. You know, like the Baylor has a great heart hospital in Plano, but they already done 3 expansions. 3. So the hospital should be getting smaller, but instead they're getting bigger, and they're opening all over the place. Every corner of the city, there's different kinds of hospitals. So if this is the picture of the physician. This is what we do every single day. Okay? We're just mopping up the floor, okay? And from the overflowing sink, and we forget to shut down the faucet. Okay? There is a way. All we need to do is go and then just shut off the water instead of just mopping up the floor. So this is a picture of Dr. Crow. Okay? He's a chief of breast surgery at Cleveland Clinic. As many of you may know, Cleveland Clinic is one of the premier medical centers across the country. Okay? So one day he had a long surgical schedule, and then afterwards he's in the recovery room writing his orders, and then all of a sudden he had a massive heart attack. Okay? Luckily he was at the hospital, Cleveland Clinic, which has one of the best cardiology and cardiothoracic surgery program. They rushed him up to the cath lab, and where he died basically 3 times. Okay? So I'm going to share a little bit more about his story as we go on. But we are dealing with crisis in this country. Okay? We spent about $3.5 trillion last year on healthcare. $3.5 trillion. And 75% of that is due to the chronic disease. And by year 2026, we're going to be spending $5.7 trillion. And majority of them are chronic disease that can be prevented and reversed simply by diet and lifestyle changes. Okay? Per capita, we're spending over $10,000 in healthcare. Okay? That is significantly more, 100% more than other developed countries. But while we're spending $10,000 per capita in healthcare, we're spending approximately about $173 per capita per person in this country on preventative care. Something is not right, right? Well, I should really say it's $10,000 per capita on sick care, not health care. And we rank number 29 among 35 developed countries on U.S. Infant mortality rate, and 26 in the U.S. life expectancy, okay, compared to the other 35 developed countries. So we may spend the most in healthcare, however, we don't even rank a top third as far as the life expectancy is concerned. These are the list of top 10 causes of death in U.S. Number 1 is heart disease. Okay? More women, women are, many of them are focused on breast cancer, as they should. Okay? However, more women die from heart disease than all cancers combined. Okay? And then you got other respiratory disease, strokes, Alzheimer's. And then, many of you probably noticed recent news that celebrities that are killing themselves, okay, due to depression. And even depression themselves, we can potentially prevent by changing our diet and lifestyle. Okay? And since the 90s, there are an increase of 25% of suicide rate in this country. So, as I said before, 1 in 4 death in the U.S. is due to heart disease. Okay? There's 1 death from cardiovascular disease every 40 seconds in this country. Okay? There's about 800,000 cardiovascular disease-related deaths in 2017. 1 heart attack every 30 seconds, okay? And then 1 stroke every 40 seconds in the U.S. So our talk is for about 2 hours or so, 1 hour for me and 1 hour for Mira. And by the end of this seminar, there'll be about 180 people who would have died from heart disease or cardiovascular disease, which can mostly be prevented. Number 2 cause of death is cancer. Okay? So in 2018, they expect over 1.7 million new cases of cancer, and majority of it, again, is preventable. Okay? And then over 600,000 people will be dying this year from cancer. And as I mentioned before, 2 out of 5 of you will be suffering from and diagnosed with cancer in your lifetime. Okay. Most common cancers are breast, lung, prostate, and colorectal cancer. How about diabetes? Okay. As I mentioned, by year 2020, which is about a year and a half away, 50% of Americans will be either diabetic or pre-diabetic. That's just an astonishing number. 70% of Americans are already obese or overweight. Okay? Additional, nearly 8% are severely obese. That's with the BMI, body mass index, of 25. But if you really want to live long and then healthy, the BMI really should be at 23. If you say BMI is 23, 88% of Americans are either overweight or obese. Nearly 90%. Okay? This was the diagram by the CDC. In 1995, the number of people with the actual diagnosis of diabetes. And this is what happened in 2015. And color is getting darker and darker and darker. Right? And this is what happens with the complication from diabetes. You may need an amputation. It may lead to blindness, kidney dialysis because your kidney is going to fail, heart attack, strokes, mostly from the cardiovascular disease. Okay? So this is a picture from my, I think, 20th year anniversary from high school. And all my buddies, these were top athletes. I wasn't, but these are the rest of the friends who are top athletes. They're football players, tennis players, wrestlers. And they reflect the population in the US, and most of them are overweight or obese. And this was me a few years back. Okay? I mean, I was kind of embarrassed. I mean, got a really chubby face right there, right? And so with this weight, a BMI of 24.7 is almost borderline overweight by standard, but it is overweight if you consider the BMI of 23 and below to be the normal BMI. Okay? I also had a very high triglyceride and high LDL. So I knew something had to change. But what really made the change was also I couldn't fit into my suit. Okay? And there's no way that I was going to alter my suit. I ended up altering it because I lost about 20 pounds pretty quickly. Okay? So this is what the Americans are eating. Okay? The standard American diet, which is a sad diet. 53% of the calories the Americans are eating comes from processed food. Okay? 32% from animal products and 11% from fruits and vegetables. But the sad thing is that 50% of the 11% is actually French fries and ketchup. They're considered fruits and vegetables. Okay? And 3 or 4% from grains. So nearly 92% of the diet that is coming from processed food, animal products, and then also processed fruits and vegetables. Okay? This is a part of the reason why we're having crisis with obesity, heart disease, and cancer. Okay? So with the sad American diet, and this is the source, and this is the cause of obesity, heart disease, diabetes, and cancer, okay? And many, many other chronic diseases. So this is the picture of what's happening. If you consider all the red meat, poultry, and fish, from 1909, average consumption of this by Americans were about 103 pounds per year. Even then, that is a pretty significant amount. But then, year 2004 was about 201 pounds, and then it started to decline. But bam, by 2015, it started rising again. The latest data in 2015 shows Americans are eating about 224.4 pounds. That's an enormous amount of meat every year. Okay? How about chicken? By 1909, it was about 10 pounds per capita. Okay? And then by 2006, it was 60 pounds per person. And then it started to decline, but then now it's back up to 92 pounds per capita. Okay? So this past year in the Super Bowl, there were about 1.35 billion wings were consumed during the Super Bowl. 1.35 billion. Okay? How about cheese? Okay, most people don't think that cheese is a crisis. Cheese, 80% of it is a saturated fat. Also has casein. So it's a dairy protein which has demonstrated it causes cancer. Okay? Also, cheese is very addictive because it has casomorphine. It's a weaker form of opioid. It's one of the byproducts. Okay? And significant amount of salt. But look at this. In 1909, there were about 3.8 pounds of consumption per capita. Okay? Now, 2013, 33, and it keeps on rising. In 2016, it's 38.5 pounds per person. Somebody is eating about 80 pounds because I'm not eating it. Somebody is eating my portion. But the sad thing is that the dairy industry is really supported by the government. Okay? And there's a significant amount of funding that goes to support the dairy industry. And government is the largest customer of dairy products, including cheese. And they're actually also funding all these companies to, giving them marketing dollars so that they can develop more products with cheese. So as you can see, our government is really not looking after our interests at all. Okay? So you have to do it yourself. Okay? So, behold the power of cheese, right? You've seen that ad. So this is what happens when you develop heart disease. On the left, that is the artery that's wide open. This is, the picture of a normal-looking artery. And this is the artery of somebody with severe heart disease and atherosclerosis. Here you'll see a bunch of calcification, smooth muscle cell infiltrating into the vessel, and then the hole has gotten really small, so very stenotic. But how does a heart disease happen? So up here is the blood vessel, blood is flowing, and this is what we call endothelial cell. So this is similar to, see the dark line here? So that is a one-cell layer. It's called endothelium. That's one of the most important structure in our body. Okay? But when you have high cholesterol, and then that infiltrate into the arterial wall, okay? Then your immune system comes, says, okay, well, you got the bad cholesterol in your system. We're going to collect it, and then it becomes the foam cells, and then this becomes extremely inflammatory. So this portion becomes really, really weak. So how does a heart attack happen? So when you have inflammation, okay, the cell wall gets really thin, and then from the sheer force of the blood vessel, okay, blood flowing through your artery, it tears the plaque. And then when it does, then platelet gets together, and then it clogs the vessel. This is how the heart attack happens. Also, when you're eating any kind of meat product, such as red meat, whether it's egg, whether it's chicken, whether it's fish, when you consume them, once it goes into your gut bacteria converts the byproduct into a trimethylamine, which is one of the most inflammatory agents in your body. And then it causes heart disease, kidney disease, heart failure, and atherosclerosis. But trimethylamine also can convert to what we call nitrosamine. Nitrosamine is one of the pretty potent carcinogen that can cause cancer. But not only that, when you are cooking animal products, okay, one of the byproducts is heterocyclic amine, and that's also extremely carcinogenic, which means it's going to cause cancer. Okay? So World Health Organization that oversees healthcare for the all around the world, okay, has categorized the different carcinogens, agents that causes cancer. And processed meat, such as bacon, sausage, right, and then lunchable meat as category 1, group 1, which means if you consume them, it will cause cancer. And the other agents, such as plutonium, cigarette, asbestos, are also group 1, along with the processed meat. And then all the other red meats are category 2A, which means it will probably cause cancer. And this is how the cancer cells develop. Because you remember when I said every single one of us have cancer cells? It takes many, many years for it to become clinically significant. Okay? So it takes anywhere from 10 to 20 years before it can be even detectable. So when somebody goes and gets a mammogram and actually have a detection of breast cancer, it's not an early detection. That's really a late detection. So we need to do everything that we can to prevent cancer from propagating. And this is one of the images of what happens. There are different stages of cancer cells. And then the cancer cell sends out the signal so that blood vessels will grow into the tumor. Okay? When it does, then that's how it gets metastasized. So what we're doing is we're doing everything that we can, because there's so many agents in our food that we eat that can prevent the blood vessels to form around the tumor. How about diabetes? Okay? And type 2 diabetes is what we're mostly talking about, but through diet, nutrition, and lifestyle changes, we can also significantly improve type 1 diabetes also. But what we can prevent and really reverse is the type 2 diabetes, which is the insulin resistance. Okay? This is how the insulin works. When you're eating, whether it's not just the carbohydrate, but even fat, protein, your body releases insulin. You're consuming energy. So then it goes to the cell, especially the skeletal muscle cells and liver cells, And then the insulin is like a key. And then it tries to unlock so that the cell's door would open, and then the carbohydrate can enter into the cell. Insulin resistance is when your cell is accumulated with fat. It's called intramyocellular lipid. Okay? Doctors and scientists cannot call it just fat because it doesn't sound important enough. So you have to call it intramyocellular, so that means it's inside the muscle cell lipid. Okay? When you have a lot of lipids inside the cell, it basically clogs the system. It jams the lock so that even your body is releasing insulin, it can't open the gate. Okay? And that's therefore the end result is rise in blood sugar. Blood sugar goes up. Okay? So we're going to get back to Dr. Crow, the surgeon from Cleveland Clinic. Okay? So this is what happened. Picture on the left is when he had the heart attack and he had the arthrogram. It's significantly clogged. Okay? And then through a lifestyle change, 2.5 years later, look at his vessel. It's wide open. Okay? It doesn't look like he had a heart attack. Okay? What happened was his office was right next to Dr. Esselstyn, one of the pioneers of plant-based nutrition. And he said, hey, Dr. Crow, you have absolutely nothing to lose. Because what he was told was the type of heart attack he had and the vessel disease he had, the cardiologist, interventional cardiologist could not place a stent. He couldn't even have a cardiothoracic surgery and have a bypass surgery. He had to be managed, his heart disease had to be managed through just medicine. So that means it's almost a death sentence. Sooner or later, he may have another heart attack. So he was obviously just very depressed, but Dr. Esselstyn said, you got nothing to lose. You might as well try the plant-based lifestyle. And this is what happened. This is the end result. Completely open vessel. Okay? And then 2.5 years later, after the arthrogram, other cardiologists were shocked, right? Because there's no evidence of heart disease. So heart disease can be reversed. And many of you who've been to my seminars before, I always say that heart disease and heart attack is a choice. You choose to have the heart attack once you gain the knowledge. So after today, I hope none of you have heart attack, because if you do, then it's going to be essentially your choice. Okay? So this is one of the early study of Dr. Esselstyn's study. So this was the 18 patients, the worst patients the Cleveland Clinic cardiologist department had. And then subsequent to this, he did a much larger study. But of the 18 patients, they had a total of 49 cardiac events, whether it's a stroke, heart attack, or chest pain, or a stent placement. And they were all placed in the whole food plant-based nutrition lifestyle. And they studied them for 12 years. Out of 18 patients, there was only one, about 1.5 years later, veered off the wrong way, and then started eating meat again, and then soon afterwards had a stroke. But of the 17 who were completely compliant, 12 years later, there was zero cardiac event. Okay? All of them combined had a total of 49 cardiac events before. Afterwards, after being on diet for 12 years, zero. So after 20 years later, they all had a reunion, and at the time, still zero. Every single one of them were alive, and zero cardiac event. This is another study done by Dr. Ornish, another pioneer in whole food plant-based nutrition. And so this is a patient who had before, and you can see how the vessel was very constricting. Afterwards, the vessels were opening again. The heart disease is reversing. But the important thing is he did a PET scan. So in this picture, where it's blue, there's no blood flow. Where it's orange, there is blood flow. After being on whole food plant-based nutrition and then lifestyle change, started reversing, and then more blood was flowing into the area that had no blood flow. And then, so he also measured the diameter of the artery. Okay? So he compared the patients who are on control, which means typical standard American diet, versus people who went on whole food plant-based nutrition. They all started around the same diameter of the heart vessel. Okay? The one who was under control, the typical standard American diet, the stenosis, it kept on getting worse and worse and worse. Okay? Versus the one who was under treatment of whole food plant-based, the vessels started opening up. Okay? This is a study of 12 different countries and looking at people who had comparing the consumption of whole food, plant-based, unrefined plant food, and comparing that to the number of death from heart disease or cancer, looking at the age between 55 and 75. Okay? So the countries on your right-hand side consume majority of their calories came from whole food, plant-based, that had the least amount of death from heart disease and cancer. To the left, these are the countries. You know, I'm surprised that the U.S. wasn't the worst country. Hungary is actually worse than the U.S. Majority of their they ate the least amount of whole food plant-based nutrition. But if you think about it, remember I said 11% came from fruits and vegetables, and then 50% is actually the processed vegetables and fruit. But these two countries had the most amount of death from heart disease and cancer. It's a direct correlation. And Dr. Campbell is another pioneer in the whole food plant-based nutrition and wrote the book China Study. If you haven't had the chance to read it, I strongly recommend it. And this study showed the strong correlation between the animal protein with cancer. Okay? More animal protein you ate, and more cancer that you had. Okay? And then blood cholesterol had a very strong correlation with cancer risk also. So breast cancer is one of the most common cancer that we experience, American women experience. 12% of women will be diagnosed with breast cancer. In 2017, there were over 300,000 new cases, and 40,000 deaths occurs every single year from breast cancer. Okay? So some of the risk factor is obesity. Okay? If you're overweight, not even obese, but overweight, your risk increased by 1.5 times. Okay? And then if you're obese, your risk goes by 2 times. And then if you're not exercising, so chances are if you're obese, many may not be exercising either, so your risk also inclines by 25%. And also alcohol has a significant effect and increases the risk of breast cancer as well. Okay. But if you're consuming a lot of fruits and vegetables, your risk of developing breast cancer declines. Even you have breast cancer, chances of recurrence declines, and then also chances of you surviving breast cancer increases significantly also. If you're obese, overweight, chances are you have high cholesterol, and then you're going to be on drug statin. Every family practitioners and internists and cardiologists are pushing these drugs. But many cardiologists that I know won't even take statin due to the potential complication. And one of them is also breast cancer. Okay? You're trying to lower the cholesterol by taking statin, but you're increasing risk of also breast cancer. Some of the things that helps with the breast cancer also, flax seeds, which is high source of omega-3 fatty acid, but it has lignin, which has a lot of anti-cancer properties. Also soy, there's a lot of debate about soy, but that debate and myth has been debunked a long time ago, many times over. Okay? Community that consumes most amount of soy has the least amount of breast cancer, prostate cancer. Also, if you have breast cancer, you have better chance of beating it, and also it improve decrease the risk of recurrence rate also. Prostate cancer, over 160,000 new cases every single year, close to about 30,000 deaths every single year from prostate cancer. 1 in 7 men will be diagnosed with prostate cancer in their lifetime. Okay? And second leading cause of cancer death in American men. Okay? But many, if you're diagnosed with prostate cancer, many may be treated surgically, but only 1 out of 49 men who are treated traditionally survives and then lives longer. 1 in 49. It's not a very good rate. Why are they getting treated? Okay? Taking out the prostate, causing incontinence, and then impotence. So only thing that has actually shown to reverse prostate cancer is diet and lifestyle change. Dr. Ornish, again, the pioneer, had done this study, compared the 42 men with a standard American diet versus the 42 men who changed their lifestyle and changed their diet. the 42 men who had the standard American diet, their PSA is usually the substance that they measure to see whether you're getting worse or improving from the prostate cancer. Everyone, on average, PSA level increased. Versus the people who are on whole food plant-based nutrition, where the average PSA dropped from 6.3 to 5.8, and none require further treatment. Okay. What if you actually have an advanced disease, right? So they compare the standard American diet along with the plant-based nutrition, and the ones who had a surgery, prior surgery, and then this is a recurrent patients. So they have pretty much an advanced prostate cancer. So average survival rate of patients who went on plant-based journey, survival rate was 19 years. So most of them probably lived a full life. Okay? Versus who stayed on standard American diet, survival rate was 6 years. 3 times the difference, 3 times. And some say, well, how can diet and nutrition change, if I have a family gene? My father had prostate cancer, my mother had breast cancer. Well, this is a study where demonstrating what you eat and diet and nutrition can actually change your genetics. Okay? You can turn, even you are born with certain genes, you can turn on the cancer genes, turn off the cancer genes. This picture on the left, where it's red, it means the cancer genes are turned on. After being on whole food plant-based nutrition as well as a lifestyle change, look at all the red that's been turned off. Green means it's been turned off. They said they have so far been able to identify 500 different kinds of cancer genes that the nutrition and changing in diet can affect. It can turn on or off the gene. And most of it is through the gut bacteria and our microbiome that we carry. How about diabetes? This is one of a fairly large study looking at 60,000 Adventists. And this is a very healthy group of population anyways in Southern California. And the religion promotes vegetarian diet or vegan diet. And even they consume meat, they consume only a very small portion. Even then, when you look at the BMI, body mass index, the only group, okay, this wasn't even distinguishing healthy vegans versus non-healthy vegans, because potato chips are vegan, Oreos are vegan, right? That's not what we're promoting. Okay? We're promoting whole food, plant-based, vegan diet. Okay? They're the only one who are within a normal BMI range. Everyone else were overweight. And even then, these groups are healthier than most of the Americans. But their BMI had a direct correlation with prevalence of type 2 diabetes. The vegans had the lowest prevalence of type 2 diabetes versus the omnivores, the meat eaters. And here's another study Dr. Neil Bernard, another pioneer, have done, comparing the type 2 diabetic patients, the low-fat vegan diet versus American Diabetic Association diet. So, when you go to your doctor, family practitioner, or internist, and you're diagnosed with type 2 diabetes, most likely they're going to recommend ADA diet. That's supposed to be a really healthy diet, right? So low-fat vegan diet was comparing themselves with the American Diabetic Association diet, and this is what happened. So if you, one way to measure the significance of the type 2 diabetes is by getting hemoglobin A1C. Okay? So the vegan group, actually the A1C was slightly higher than the people who are on the ADA diet. And they checked them again at week 11 and week 22. Okay? So you can see the decline of the A1C from 8.1 to 6.8 among the vegan diet, versus the people who are on American Diabetic Association diet went from 7.9 to just 7.5. So then why are physicians recommending ADA versus a vegan diet? Because most doctors don't believe people can do it. Well, at least you need to give them the information, let people make the decision for themselves, right? So type 2 diabetes is reversible. And we have seen patients who attend the seminars gain the knowledge, and they do it themselves. They don't need their doctor, because after you attend the seminar, you'll have more knowledge on how to treat your own disease than some of your family practitioners and internists. Okay, how about the LDL cholesterol in the same group? Okay? The group that participated in the vegan diet had decrease of their LDL by 21% versus an ABA diet only 9%. Significant difference. This is Rita. So she gave us a permission to talk about her and then about her testimonial. So she started attending our seminar since October, and we host the monthly seminar. This is our first time here in Dallas, and so great to see so many of you join us today. But then she was kind of like trying the whole food plant-based for maybe about a month, and then things in life happened, so she would stop and she would go back and forth. Finally, in January, she decided she's going to change. She's going to do 100% whole food plant-based. She's been suffering from type 2 diabetes for 13 years. But she's not only type 2 diabetes with oral medication, but she was also on insulin because her diabetes was so bad. Her A1C was 12.5. That's really bad, really bad. And her fasting glucose was 280. That's extremely bad. And her LDL, they couldn't even measure it because it was off the chart. Okay? And then, so in January, she finally said, okay, I'm going to go on whole food plant-based. So you can see that she was on 2 different kinds of oral medication, metformin and glipizide, and then also on insulin. Okay? And 2 high blood pressure medicine, as well as cholesterol med. Okay? She's, even on all these medications, she's never seen normal blood glucose level, normal blood sugar level. So what happened? After 10 days, she's been on this medication for 13 years. After 10 days, she discontinued all insulin. After 10 days. Okay? And her fasting glucose, it was between 72 to 84. And it was 280 before. Right? So now, even after a meal, her blood sugar level is within normal range. Okay? After 2 weeks, she discontinued her oral medication by 50%. And then by week 7, she was off of all medication. She's been cured from type 2 diabetes. And she's also lost weight, great side effect. And then she also suffered from some GI issues that none of her physicians could really figure out. But that was also resolved as well. And this is a text message she sent me. Okay? So she feels rejuvenated, more energy, and also took her depression away. Because your gut bacteria can change within 2 weeks of being on a new plant-based diet. And it has been demonstrated. And based on type of bacteria that you have and diversity of bacteria that you have and the density, your behavior and personality can change. This has been clearly documented. And she also stated that, how can I choose, knowing what I know now, to go back? It would be committing slow, cruel suicide. So what is a diet or nutrition and lifestyle that can prevent, reverse heart disease, prevent, suspend, reverse many other cancer, hypertension, stroke, diabetes, and then also help you lose weight and keep them off. Help you live longer and live younger. Okay? And we believe that the best nutrition and lifestyle is a whole food plant-based. These are a list of all the other diseases that it would help. And as you can see, some of them, such as Alzheimer's, and multiple sclerosis, and many other autoimmune diseases, such as lupus and rheumatoid arthritis, and even erectile dysfunction for guys, right? And erectile dysfunction is the first sign that somebody has a cardiovascular disease. After being on whole food plant-based nutrition, you're gonna get happy. Or maybe not for some. Okay? So what is a whole food plant-based nutrition? It's a whole, unrefined or minimally refined plant. And you got to really, really think about, what I put in my mouth. Does it have fiber? Okay? Everything that is a plant-based has fiber, whether it's fruit, vegetables, okay? Legumes, beans, lentils, right? Whole grains, nuts and seeds. They all have fiber. If you eat things that has fiber, okay, then you can prevent and reverse many other chronic diseases. Okay? So what are they? Okay? As I mentioned, fruits, vegetables, whole grains, beans, legumes, lentils, nuts and seeds. They all have fiber. right? And then you got to drink lots of water. So all these have a lot of anti-inflammatory properties, antioxidant property, and has a lot of phytonutrients. These are the ones that's going to heal your body. Right? What should we avoid? Okay? Any animal products. Okay? Meat, poultry, fish. Okay? If it poops, you shouldn't eat it. Okay? If it has a face, you shouldn't eat it. Okay? And also it includes eggs, dairy products, okay? Processed oil. So there's no such a thing as healthy oil. And people always ask, well, is olive oil healthier than canola oil or different kinds of oil? Yes, it may be. However, is it healthy? Absolutely not. And most people don't understand what it means by extra virgin olive oil. Right? Extra virgin means it's cold pressed because olive oil is very sensitive to heat. Okay? By heating it, it becomes unstable and it becomes toxic. And people are cooking with extra virgin olive oil. So you pay extra to get extra virgin, so it's cold pressed, but then now you're cooking with it. It doesn't make sense. Okay? And then also, even it may come from plant, if it's refined grains, refined sugar, stay away. Okay? And I get this question a lot. Well, do I need to buy organic? The most important thing is whether it's organic or not. Fruits and vegetables, you should eat it. Okay? Even if it's not available to you, or if it's too expensive, then take it home. Just rinse it vigorously. You will get all the pesticides off 95% of the time. Okay? Bless you. But if you want to purchase the organic, so these are what we consider dirty dozen. Every year it changes. So these are the food that you should consider purchasing organic. Okay? And these are conventional clean 15, which means don't waste your money buying organic. Right? Because most of them have really thick skin. However, there's some like cauliflower and broccoli. I was really surprised to see that. Don't buy them organic. Don't waste your money. Okay? And we get this question all the time, right? How do you get protein from eating plants? Every single plant food has protein. Every single one of them. Okay? Some may have more than the others, but if you eat enough, okay, at the hospital, those massive hospitals, the pictures that I showed you, in the wing that actually has all the patients with the protein deficiencies, it's completely empty. Okay? There's no one in this country. If you eat enough calories, we're more concerned about people eating too much calories and consuming too much protein. Okay? So you don't have to worry about protein. What if somebody ever asks you that? You should ask them, well, where do you get your fiber? Okay. So look at all these top professional athletes. They're all vegan. Patrick, for example, is the world's strongest man alive. Okay? And some of the others, whether they're the UFC fighters, they're bodybuilders, hockey players, football players. And 1/3 of the Tennessee Titan football players, NFL players, are now whole food plant-based. Okay? Well, how about then comparing 100 grams of beans, red beans, to 100 grams of beef? Okay? They have the same amount of protein, 22 grams. Okay? But again, the most important thing is the fiber. You notice beef, 0 fiber, 15 grams of fiber in beans. The civilization that consumes most amount of fiber has least amount of heart disease, diabetes, cancer, and any other chronic disease. There's many people who are doing low carb, Paleolithic diet, paleo diet. Says well our ancestors were the hunter and gatherers, and they think that they ate a lot of meat. Well, humans don't have any claws. We don't have a really big incisors. And we're really slow, so we can't chase after the animals to hunt. Okay? Most of the time, it was a woman that did the gathering, the berries and tubers, and fed the family because the guys came home empty-handed majority of time. Okay? And then now, with the technology, they're able to study the fossils of the stools. And the paleo ancestors consumed approximately 100 to 150 grams of fiber per day. Okay? And now they can study a very similar civilization in Tanzania, Habas, and they had lived in the same style for over 10,000 years. Even today, they consume about 100 to 150 grams of fiber every single day. There's no heart disease, there's no cancer, there's no diabetes, no chronic disease in that community. Okay? Average Americans consume about 10 to 15 grams of fiber per day. 10 to 15. Okay? That's pretty sad, right? Because they're having sad diet. And the recommended dose, which is extremely low, the minimum for women is 28, for men is 38. Even then, that's really low. We should be shooting for 80. If we want to prevent the chronic disease, minimum 50, shoot for 80. I try to shoot for 100, and it's really hard. You can't eat that much. So, I showed this cartoon, in all the talk, and these are the cows being led to the slaughterhouse. And they say, my only consolation is by eating us, they're killing themselves. Okay? That's what Americans are doing every single day. But the sad thing is now the Western diet has been migrating to all the other countries, Asia, South America, and they're facing the same problem. Okay? But there is a side effect of whole food plant-based nutrition. Okay? Because as I've mentioned the side effect before, there's a weight loss that comes with it. Okay? And so you might be tempted to wear the skinny jeans. So as I said, the heart attack is a choice. Okay? Diabetes is a choice. Okay? So overall, the chronic disease is a choice. Okay? So what is your choice? Okay? I've made my choice, and I chose to go from here to here. Okay? And I just turned 47, and I feel stronger and younger, and my skin is even better also. Okay? Than when I was 27 years old. And we have a monthly seminar because our goal is to spread the knowledge of whole food plant-based, to empower you with the knowledge so you can do this yourself. Rather than going to the pharmacy at the grocery store, you should be turning and going to the produce section, because that's where all your medicine is. Okay? And you keep on coming to the seminar, you'll gain more knowledge. You'll have more knowledge of how to heal yourself than your family doctors and your internists and your oncologists. I'm still shocked that I get emails, text messages, and messages through the social media, people with cancer. Okay? And their oncologists are telling them that before your chemo treatment, okay, you need protein. Protein is like pouring the fire. Pouring the gasoline over a fire. Okay? They don't understand. Well, because when I was in medical school, I had less than 1 hour of nutrition class. So we don't know. I have no idea. Okay? I've gone to 4 years of medical school, 5 years of residency, another year of fellowship, and been practicing for 14 years. Okay? I had to study on my own. Okay? So I am so glad, so happy there's so many of you here, so you can learn how to heal your body on your own. Okay? But we'll do everything that we can to help you achieve that goal. Okay? So every month we talk about different topics. So today we talked about the introduction, and then we get really in depth into how to reverse heart disease, how to reverse diabetes. Another month, how to prevent and suspend and reverse cancer, and how to improve your gut microbiome so that, because gut microbiome is essentially the gateway to maintaining great health. This is my social media platforms. As I mentioned before, if you message me, I answer just about everyone's question. And then we have a Facebook group called Regenerative Plant-Based Nutrition. So feel free to reach out to me at any time, and then join our group, and so we can share the knowledge together. Okay? So we'll take a couple questions, and then at the end we'll take a lot more questions, and after Mira's talk. So anyone has any questions? Yes, ma'am.
Why don't you recommend eating eggs? Like, I have 3 young kids, so
yes.
What is the breakfast every day? They want something different. What's the year?
Great question, and Mira's going to go over to some of them. So then the eggs also is number 1 source for cholesterol, saturated fat. Okay. Also has any animal products, but especially eggs, has a lot of choline. So when they're consuming eggs, once it goes into their gut bacteria is converting them, and byproduct is trimethylene, which is then very inflammatory. It goes to the liver, and it gets oxidized, and that causes atherosclerosis, cause heart disease, liver disease. Kids between, so let me take a poll here. kids in America between age 12 to 14, okay? Do you think they, how many of them do you think that actually has early signs of atherosclerosis? Who say less than 10%? 20%? 30%? 40%? Okay, I'll take 50%. 60%? 70%?
I work at a school.
Yeah.
So I
65% of the kids in the U.S. between age 12 and 14 have early signs of atherosclerosis. 65. An additional 8% have more advanced atherosclerosis between 12 to 14. So this is a crisis. Okay? So what do you feed them? Mira's going to talk about it, but there's a lot of different things. Like oatmeal with berries, and that's pretty much the standard. You can also have smoothies, and we're putting together a list of things that are healthy choice for kids, because it is a challenge for families. So you can change yourself, but you want to get them started as early as possible. Okay? Because the kids, when they're young, they tend to go after fruits and vegetables. Okay? Unless you teach them and guiding them to the animal products. But you want to switch it as quickly as possible. Okay? Yes, ma'am?
Yeah. What's the difference? Can we purchase GMO or just non-GMO?
Yeah, because there's so much unknown about GMO. You never, you just don't know. So I tend to look for non-GMO product. But I know a lot of the omnivores also say, well, they're looking after the GMO and they're eating non-GMO products. But all the animals, when they feed them, all the grains and all what animals eat, they're GMO products. GMO soy, GMO grain. So they serve the animal GMO products, right? And then after that, 90% of soy that's produced in this country are GMO. The one that's consumed by human are non-GMO, 99% of the time. So all that soy is produced for cow, and then they're feeding the cow of the GMO product. Same thing with corn, okay? And all the other grains. And then after that, okay, you're looking for non-GMO products, but you're eating GMO meat. 80% of the antibiotics that's produced in this country are produced to feed the animals. 80%. For two reasons. They're all living in a really close quarter. They're pecking one another. They're infected. Okay? The government allows so many pus per gallon of milk. Okay? That is legal to have pus in your milk. Okay? So they have to serve them antibiotics, which also causes the antibiotic-resistant bacteria, right? But also it allows the animals to grow really fast. So they're serving antibiotics. There's so many reasons why we shouldn't be consuming animal products. Okay? But I always stress it's not about what you don't eat. It's really all about what you do consume. Okay? Because you need to be thinking about every time you take a bite, you should consider, is this going to heal me? Because by the time you're 40, you've done so much damage to your body. Okay? We need to think about how can we heal our body. I'll take one more question, and then I'm going to be around afterwards to answer everyone's question. Yes.
Yes, for cooking the vegetables.
Yes.
Besides steaming, what other way we can cook it? Because we are using the oil.
Yeah.
Now I'm seeing that it's not good.
Yes.
And then another is the milk. Here I drink milk because it's the main source of calcium. So what other? How can I substitute that?
Yeah.
With the plant-based?
Yeah. A great question. First of all, with the vegetables, Mira's going to go over how you can prepare some of the vegetables also. You can steam it, you can stir fry it also, and you don't have to use oil. And then there's certain techniques that you can utilize, which we'll go over. But a lot of times, I use either water or vegetable broth, and heat it to a certain temperature, and then you close the lid. And then there's a lot of also the water that comes from the vegetables, and so that it doesn't stick. Okay? And so it's just, you have to learn just a new way of cooking, and it's not challenging, because if I can do it, anybody can do it. Okay? And through this journey, I learned how to cook. I don't know if you can call it cooking, but make meals for myself, and I discovered so many different things. Rather than oil, and using a lot of different kinds of spices that has a lot of anti-inflammatory, antioxidant, anti-cancer properties. And I didn't know such a thing as cumin existed, or oregano, coriander, and paprika, all those things. And then regarding the milk, okay, most of the milk product, the calcium is fortified. Okay, and you can actually get more calcium from eating broccoli, spinach, than milk. Okay? So the calcium, you should be concerned about vitamin D3 rather than calcium. Okay? If you eat enough vegetables, you're going to get plenty of calcium. Okay? Also, when you consume milk or animal product, your body becomes acidic, so it's more acidic. So it actually pulls the calcium out of your bone. So it can, the population that consumes the most amount of milk has the most amount of osteoporotic hip fracture. So you become more osteoporotic. And there's a lot of other the milk product, the plant-based milk product that's out there, whether it's almond, whether it's cashew, whether it's soy. So there's plenty of options. You do not have to worry about calcium. Okay? So, one more.
How does it work with the autoimmune disease?
Yes. Yeah, that's a pretty complex issue, and we actually have a whole seminar about that, also how to heal the gut bacteria. But with the autoimmune, is what you're doing is you're healing the gut. Okay? So autoimmune disease, what happens is most people consume minimum amount of fiber, and you have to feed the gut bacteria. So over 90 to 100 trillion bacteria in our gut, and we carry about 100 trillion bacteria. Okay? So there's about 10 times more bacteria that we carry than our own cells. So when they did the experiment, if you don't feed fiber, right, there's a mucus layer around the villi in your colon. It gets really, really thin. So the gut bacteria comes really close. And then some of the food products and particles and chemicals and toxins get infiltrated into our own cell. Our body recognizes it as a foreign body, and then starts attacking it. But then our body may have a similar type of protein structure, so that our own immune system is starting to attack. So when you heal your gut, that's how you start healing your body and then reversing the autoimmune disease. And I didn't show it today, but we have Denise who had rheumatoid arthritis, been on chemotherapy treatment, and Humira, you see the TV commercials all the time, right? One of the side effects is heart attack and heart disease. So she started having signs and symptoms of heart disease, so she stopped taking Humira, and then stopped decreasing sugar intake. And then in December she came to our seminar, so starting January she went on whole food plant-based. Okay? So remember, she was on chemotherapy for her rheumatoid arthritis. Okay? Within 2 months, she was in remission of rheumatoid arthritis. Within 4 months, her doctors couldn't find the rheumatoid markers in her blood, so she's been cured of rheumatoid arthritis. You can say the same thing about lupus and many other autoimmune diseases, even multiple sclerosis. Okay? And there are some people who get debilitated and then essentially die from multiple sclerosis. That can completely be reversed. I know 2 physicians who have multiple sclerosis, and they basically are controlling their symptoms and reverse some of their multiple sclerosis, their autoimmune disease. Okay? So, thank you everyone. And then.